I'm Dr. Lauren Sparks. I'm a doctorally trained nurse practitioner. I'm also a therapist. And more importantly, I've walked through the fire of erythromelalgia as well as chronic inflammatory response syndrome. I'm here to tell you that there's hope for your healing, lots of it. Today, let's talk about navigating the complexities of CIRS within the wider medical system. So you finally have a diagnosis of CIRS after probably many years of navigating the medical system, and you begin to share this diagnosis with other medical providers. It can be really hard because it can be met with resistance. You may feel misbelieved. This can lead to medical trauma or more medical trauma, unfortunately. And it occurs because the disease process is poorly understood in the traditional medical system. So your doctor may have never heard the term chronic inflammatory response syndrome. They may do a quick cursory Google search and up pops information that is delegitimizing it, that is not paying credence to the deep evidence base of peer-reviewed, reproducible literature. And so immediately they have a bad taste in their mouth and they don't dive deeper into the research. It's challenging because within the medical system itself, we have big egos. There are big egos at play. And in addition to that, we are trained to believe that we need to have the answers. And so medical providers can encounter their own shame when they're presented with a disease process that they know nothing to little about. And in order to understand CIRS, it really does take an earnest effort, even from as a person who had been treated for CIRS and suffered from CIRS myself. It took quite an effort to work through Dr. Shoemaker's certification program and obtain this deep understanding of the disease process. So it's unfortunately not something where they can sign into their up-to-date account and get a quick overview of what chronic inflammatory response syndrome is. It is a complex disease process, which is why it can't easily be treated in a 10-minute medical visit. So it's complicated. They don't have the knowledge. They go to look for the knowledge, and unfortunately, they read what I would consider as misinformation about CIRS. There are big egos in the system. There's shame about not having all of the right answers. We have to have compassion, though, for our medical providers. I do believe very few people go into medicine without good intention. And so I do believe that they are earnestly wanting to help us. And unfortunately, sometimes when we have this diagnosis and we share it with them, we can experience invalidation. And that is hard for us. In addition to all of these complexities, medical providers are experiencing higher and higher rates of burnout, unfortunately. Our country has moved away from a medical system that is created for the people by the providers. And as private equity has entered more into the medical system, the doctors and nurse practitioners, they're cogs in a wheel. They're told that they have to see more and more patients. And can you imagine seeing 30, 40 patients a day? You really don't have the time to earnestly take a deep dive into this literature, unfortunately. And so medical providers are experiencing compassion fatigue and burnout that is very real, even though they are earnestly trying to do their best for their patients. So what do you do when you see a medical provider and you share your CIRS diagnosis and you are misbelieved or you are invalidated? I would encourage you to redirect your focus back to your own healing process. Does this mean you fire your medical provider? It could. It all depends on how harmful that exchange felt. I have had encounters with medical providers that did feel as if they were traumatizing, and I wouldn't want to see that medical provider again. But I would also encourage you to pause and take a deep breath and think about whether or not you may need this medical provider's help in the future. And if so, just see that medical provider for those things that you need to see that medical provider for. If they're managing hypothyroidism, for instance, you may want to continue to see that medical provider for that condition, and you may just choose not to talk a lot about your CIRS diagnosis. I certainly learned to navigate the medical system in this way so that I could avoid further medical trauma, but also get my very real medical needs met by a team of medical providers. I would also encourage you not to beat your head against a brick wall. When we figure out that we have this disease process, I think it's lovely and exciting for us to share this information with our medical provider. But if they just really aren't willing or able to educate themselves for whatever reason, I think we have to really step into, this is not about me, and I'm likely not going to change their mind. And so I'm going to put my energy elsewhere. I'm not going to beat my head against a brick wall. I'm not going to create an adversarial relationship with this medical provider. Instead, I'm going to focus back on my healing. And I think one of the most wonderful things that we can do is really celebrate medical providers who are curious, who want to learn more, who are willing to support our CIRS treatment, who are willing to collaborate with our CIRS provider. As a CIRS medical provider, I unfortunately have been really disappointed with how many medical providers are willing to collaborate. And again, I think this often goes back to the high levels of burnout they're experiencing within the traditional medical system, which is set up, unfortunately, now for profit instead of being patient-focused. So again, it can come back to humility, but when we are interacting with a medical provider who is heart-centered and who is open and curious about our disease process, I think we really have to celebrate that person. We have to take a risk, be vulnerable, tell them how much it means to us that they are willing to be open in this way. And it will really only benefit them because they will begin to see CIRS in other patients. And I can tell you, it is not a fulfilling career path to just prescribe pills. What is a fulfilling career path is to see people constantly reclaiming activities that they could no longer enjoy, to be able to engage in the things that they want to do, to come back into their full vitality. And I get to see that every day as a CIRS provider. And so when other medical providers are open to educating themselves on this disease process and to collaborating with CIRS providers, I really want to make sure that we celebrate them, that we take the risk of saying what this means to us, and that we're vulnerable in that way. If they demonstrated that they are willing to be open-minded about this disease process, it's likely they are a safe person for us to be vulnerable with. If you're benefiting from this channel, please like and subscribe. Feel free to add your own tips and tricks and stories about navigating CIRS with medical providers. And this is a place where we can share our own hard-won wisdom and benefit each other. If you have a question for me, please post it in the comments below so I can make a video to address your question specifically. Until next time, take good care. And as always, hold on to hope.